I joined the Million Veteran Program in order to ensure that veterans like myself get the absolute best care possible.
I joined the MVP program to help medical advancements for veterans that look like me.
To ensure that no veteran ever had to die from an unknown disease.
I joined MVP because I still want to be part of something bigger than myself.
To help advance and improve the care for veterans today and in the future, which very well could be my children's.
Might not help me, might not help my friends, but it'll help the next generation.
We started to hear from the veterans how this could have an impact on not just their lives, but everyone's lives. There were stories and notes about why this type of research had the potential to have an impact. And I think it was in those moments we all looked at each other and thought, this is something much bigger than any of us could have ever imagined.
When we started the program, it was, an idea. How can we leverage the amazing resources inside of the VA in order to help our veterans?
I remember the day we enrolled the first veteran, and it was really a special day. It was a culmination of an awful lot.
We had gotten the results of the focus groups and the surveys. We knew that veterans were generally very supportive of this program. To get that first response in, the first veteran to say, I'm in and I'm doing it, and I'm doing it for other veterans because I want to help other veterans. It was really exciting. It was just, such a heartwarming feeling to know that veterans were being responsive to our call and coming forward.
We started small and we grew to dozens of recruiting sites and hundreds of staff and hundreds of research projects.
We are now one of the world's largest research programs of this kind, of studying genes and health within a healthcare system.
The diversity of the cohort, I think, is what makes MVP different from other programs. And it's really representative of the veteran population.
It's historic. It's never been done before, and it's thanks to the altruism of our veterans.
We got our motto for the Million Veteran Program from our veterans. They told us that it's another way to serve. They've served their country in heroic ways, and this is yet another way for them to serve. So the potential of MVP for both veteran health and for everybody else as well is to really improve our understanding of health and disease.
The Million Veteran Program is doing research into all kinds of conditions that impact veterans. Things like TBI, PTSD, suicide prevention, cancer research.
But understanding the unique experiences of the veteran population is something that MVP is well designed to do. We are already doing it. And so not only will the impact of MVP's research be great for veterans, it's going to be great for everybody.
That's where the power of this number million comes in. And the more we have, the better we are as a group to understand all of those diseases down to the smallest populations. So we need everybody's help.
Being at this million milestone, looking back on the journey, looking back on all the veterans that we've met over the years and talked to and heard their stories, we're able to tell some of their stories. That's what makes it all worthwhile.
And to be able to see it come to fruition and to get to 1 million, it's been amazing.
There are a lot of hidden heroes. To every single person who is a part of our program, we are grateful.
I would thank all of our staff, the leadership, as well as all of the program staff who've persevered through this entire decade and more to build this program.
This is just the beginning, and we are excited for what's to come after 1 million.
My why for MVP is every veteran.
You are our why.
You are our why. The veterans are our why.
You are our why.
To each and every veteran in MVP, you are our why.